You're watching once again a YouTube video presentation of the University of Wyoming Center on Aging. I'm Scott Veach. I'm your host, and on this program we'll be discussing topics of interest for caregivers of loved ones with dementia. We hope that you will subscribe to the channel and you'll hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new program. And now, this is Once Again. Linda Wilson is our guest today. She is from Buffalo, Wyoming, and she is a dental hygienist. She is a certified nursing assistant, and she is a registered dental hygienist. She has been doing this for a long time in her career. She's very passionate about it, and we're going to be talking about oral hygiene for elders. This is actually part two of our conversation. If you go back and check on just the most recent edition of Once Again, you'll find part one of that program. Linda, thanks again for spending some time with us today. Let's talk about some of the products, because in part one we mentioned that it's not just brushing your teeth when you're dealing with the elderly. There are some products that make things a little more helpful. Does toothpaste make a difference?
Well, the way I look at toothpaste is the it's more of a therapeutic agent for strengthening the tooth surface. So oftentimes I'll recommend brushing without toothpaste and then putting the toothpaste on afterwards so that it doesn't get all rinsed out. Because if you brush your teeth and then you rinse your mouth, then you don't have the fluoride isn't staying in there and doing its work. Or the product that I recommend that I've been talking about more for elderly who may swallow and things more frequently is called hydroxyapatite. It is calcium phosphate, and that is what teeth are made of. So there's a nano hydroxyapatite that you can find in toothpaste, but not mainstream toothpaste. You have to look for it. And it is safe to swallow. It may be more effective in remineralizing older people that may have dry, I don't just say older people, but people who
Right.
may not have enough saliva.
Are there
Because
brand names that we should look for?
there's Carry Free is one, Rise Well is one. There's one called David's. All of these I think you could probably find on Amazon. However, I do have a product list. If people want to email me, I can send that to them of some products like this to use. And so brushing, cleaning in between the teeth, rinsing, and then putting the toothpaste on is more effective in what it's supposed to be doing, which is remineralizing the teeth.
How do you put it on with your finger? What do you do?
You can. You
Really?
could
I've
use a
never heard that. I've
toothpick.
never
You
heard
could
about
use your
the.
finger, and it doesn't take much, like the size of a pea or half a pea. Really, you'd be surprised. You see the toothpaste commercials, and they smear it along the whole toothbrush, and then
Mhm.
it ends up in the sink anyway, half of it. So,
Right.
um, toothpaste will go a lot longer this way too.
I remember an old joke that David Letterman did many years ago, and he said, "You don't have to worry about those little bits of toothpaste that stick in your sink because they make great after dinner mints." Now, that was just his joke. But anyway, what you talked about toothpaste not being this kind of toothpaste, no concern about swallowing. Is that a concern if someone swallows more toothpaste than they should?
Well, with certain toothpaste, it could be a concern. There are a lot of people who are worried about fluoride because in high levels it can be toxic. However, it's not in like what we find in our water system is not. But I also am concerned about the grit,
Mhm.
it's like swallowing that too. So, personally, too much of it, but Rise Well is one. They're all about you can swallow our toothpaste. Carry Free has a gel that doesn't have the grit, so
Okay.
that's always a concern.
And by the way, Linda was talking about getting in touch with her, and we will have her email address in the description box below so you can check that out. Also, I wanted to ask you about not just toothpaste. What about dental floss or tongue scrapers or that kind of thing in working with the elderly?
Absolutely. Tongue, as far as cleaning the tongue, that is very essential part of cleaning the mouth because we all have the little bumps on our tongue called
Mhm.
papilla, and the germs can really get in there. And if have bad breath, that may be the source, rather than the teeth. But tongue scraper is preferred for cleaning. You can find them in plastic or in metal, and you just put it on the back of the tongue, not too far back, and sweep toward the tip of the tongue with those. You can use a toothbrush also, always in a sweeping motion, never back and forth. But the tongue scrapers are supposedly more effective. As far as cleaning in between the teeth, if someone is able to floss their own teeth, yay, absolutely encourage that every day. But if you're providing the care for someone, rather than trying to floss their teeth, there are little picks that you can use. They're called soft picks. They're like a toothpick. um, I wish I had an example ready here, but I don't. That you can use on the in between sides of the teeth. So you don't have to put your fingers inside someone's mouth where they might close while your hands are in there.
Good point. Um, During your presentation to our group, Wyoming Dementia Together, back a couple of months ago, you also talked about something called xylitol. What is that?
Yes. Xylitol is a sugar alcohol that is used for sweetening, but it is it does not affect the blood sugar, so it's safe for diabetics, but it's also good in the mouth. It helps to starve the bad bacteria. So there's um, a mouth moisturizing gel that has a high level of xylitol in it. If you want to use something for moisturizing your mouth, I would recommend something with xylitol. But it takes 6 to 8 exposures of xylitol a day to be therapeutic. You can find it in gum, mints, toothpaste, that gel I was talking about, mouth rinse. It's getting to be a lot more common. Even the ice cubes
Hmm.
gum that you can buy at the grocery store
Mhm.
has xylitol as the first ingredient. So that would be considered therapeutic.
I've seen it. How long does it
So
take
if
you to
somebody likes to chew,
go ahead?
oh, I was just gonna say, if somebody likes to eat candy all day rather than eating sugar candy, regular sugar candy, you can buy candy that's made with xylitol, and that would be very helpful to
Mhm.
helping to maintain a healthier oral condition.
From the starting point, from the moment you start using it, how long does it take before it becomes effective?
Well, that's a very good question, and I'm not sure exactly. I would say probably that day if you're
Yeah.
getting enough exposures.
hmm we're talking about oral hygiene for elders. One area we have not covered yet is oral care for those with dentures or partials. Is that different?
It is different. For one thing, we need to be very careful not to drop appliances. And
Mm,
anytime you're providing care for someone else, you definitely want to wash your hands and wear gloves. So if you have gloves on and you are handling someone's denture or partial, that can be a very slippery mixture. So I definitely recommend having like a denture cup right at the mouth to put them right in so that you're not trying to carry it to the bathroom or carry it to the sink. You want to line the sink with a towel and some water so if that gets dropped while you're brushing them or your resident or loved one is brushing their own, that it doesn't break in the sink. It'll have a soft landing. It's important not to use toothpaste because it has grit, and grit can scratch the plastic and make it attract germs more dramatically,
Mhm.
I guess is a good term.
Right. Um, does xylitol work with dentures and partials too, or?
Absolutely. So same germs grow on your dentures and partials as grow in your mouth. I mean, they're when they're in your mouth, and it's important when you take a denture out to massage the tissues where the denture rests, so it gets some fresh blood flow. Would be a good time to put some xylitol rinse in there too. Rinse or um, the gel that has the high xylitol
Mhm.
in it. And also, if you can leave the dentures and partials out overnight, that's preferred, and they should be stored in water when they're not in someone's mouth to help prevent distortion and brittleness.
We're coming to the end of our time here. Just something that occurred to me, maybe that you've got an adult child who's caring for a parent or someone who's caring for a spouse. And maybe they've just realized that their loved one needs some help in this area. What would you recommend the first thing that they do? Talk to the dentist, take it on themselves? What would you recommend?
I would, for everyone, recommend maintaining a relationship with a dentist and a dental practice. And when your loved one goes in for a preventive care appointment or a dental care appointment, talk to the dental hygienist about an oral care plan because they can give more specific information about the best tools to use and how to and demonstrate how to use them and help you learn. So I would, with everyone, recommend asking the dental practice for an oral care plan each time you go in because situations may change or they may learn about new products or but that would be the ideal situation.
So you're saying then that even though it may sound a little daunting or scaring, it doesn't have to be, right?
It does not have to be at all. It's just, I think once you get used to it, then it's just another part of the day.
Linda Wilson has been our guest today. She is a dental hygienist. She's from Buffalo, Wyoming. Her contact information, Linda K. Wilson at iCloud.com, and we will have that email address in our discussion box below. Thank you so much for being with us today. And we thank you for joining us and watching us on this edition of Once Again. You've been watching Once Again, a YouTube video presentation of the University of Wyoming Center on Aging. We hope if you haven't done so already that you'll subscribe to the channel and hit that thumbs up like button. Both of those actions help the channel to grow and allow us to reach more people. And if you'll tap that notification bell, you'll be alerted each time we upload a new video. Thanks so much for being with us. I'm Scott Veach. We'll see you again next time.